I'm Brittany Lewis with Forbes Breaking News. Senator Mark Kelly questioned witnesses during last week's Senate Aging Committee hearing about a mental health crisis facing senior citizens. The Arizona senator argued to make healthcare both accessible and affordable, saying, quote, "Lives depend on this often." Here's more from Senator Kelly's line of questioning.
Thank you, Mr. Chairman. I was going to follow up a little bit on Senator Collins' question. I think she covered the issue, opioid epidemic and substance use disorders and how it affects older adults. And like so many other states, I'm sure like Maine, Arizona has been hit pretty hard by this. And it's not surprising that we often hear from the aging network, for lack of a better term here, that they often hear from seniors asking about what sort of substance use disorder treatment that their Medicare plan will cover, and often they don't like the answer. So if there's anything you left out about where these gaps exist in Medicare for older adults experiencing substance use disorder issues, if you just wanted to take a few more, like maybe a minute or so to fill in the gaps there. And then I've got a question for Mr. Klassen.
Thank you, Senator Kelly, for the question. As was highlighted, given the growing population, there's a growing need for these services, and Medicare, unfortunately, has limited coverage for substance use services. It's not in line with evidence-based practices and with the full treatment continuum. So there are remedies for addressing those gaps, including ensuring that the full continuum of services are covered, ensuring that the full range of addiction specialists and treatment facilities are covered, and ensuring that parity is applied here so that older adults don't experience unnecessary discrimination and financial and treatment limitations. And so through addressing those gaps, we can promote better access to care for older individuals and get more of them on the road to recovery.
Thank you. Mr. Klassen, as a peer specialist, are there programs, are your programs covered by Medicare?
Some of them are, yes.
Some of them are, but some of them are not.
That's correct.
And my understanding is 60% of mental health professionals who work in rural areas, that their programs are not covered by Medicare. Does that sound about right to you?
That sounds about right.
And imagine how disruptive this would be, for somebody who ages into Medicare, and then suddenly they find out that they can't pay their insurance. Medicare will not pay for the provider, and they have to pay out of pocket. And what this means to seniors in Arizona, and for them, it feels rather arbitrary. And they often don't have supplemental coverage needed to make this care affordable. So that's why I'm a co-sponsor of the Mental Health Access Improvement Act, which would allow licensed professional counselors and licensed marriage and family therapists to provide services under Medicare. We have to expand the universe of providers to make care accessible and affordable. I mean, literally, lives depend on this often. So, Mr. Klassen, given your personal and professional experience, is there anything you'd like to add to that, speaking to the need to bolster our workforce and ensure the continuum of care continues into Medicare?
Yeah, thank you, Senator Kelly. Yeah, it's complicated, right? A lot of stuff goes into it. A lot of older adults are reluctant to ask for help to begin with, right? We're all about rugged individualism, and I don't need public benefits and all. So part of it is relating with them on that issue. And then there's the frustration if I am seeking help and getting kicked around to different places, or the rules are different, or it just seems to be taking too long, folks just, abandon it. I think with peer support, it's an interesting idea. I think of peer support as more in direct service, but I think the idea that peers can talk to peers, older adults can talk to other older adults and relate with them, whether they're veterans or whether it's a substance abuse issue or whatever, and say, it's okay, and I have some information, I have some resources for you.
Well, thank you, Mr. Klassen, and I yield back the remainder of my time.
Senator Kelly, thanks very much. We're at a point in the hearing where we'll have